Good afternoon, everyone. Welcome to this week's session. I'm Jaideep Tandon, Chairman and CEO of Infinix, and today we're pleased to have be joined by Michael Sullivan, the CEO of PX Technologies. Welcome, Michael. Michael and I are going to sort of chat about how practices can address the labor shortages that are by implementing time-saving technology solutions. Michael, it'd be great to just get a quick background on yourself and what PX Technology does, and then we'll jump right in.
Yeah, really. Thank you, Jaideep. I appreciate the opportunity to be here today. Really excited. PX Technology is in the business of providing technology for practices that create efficiencies in a couple of different areas. And then the PX in our PX Technology name stands for patient experience. So we're really all about what we can do with technology inside the practice so that they can provide a better patient experience. So really appreciate the opportunity today.
Wonderful, thank you. Yeah, so look forward to discussing this with you. I think you and I both are living these challenges alongside our customers. So looking forward to the conversation. So just jumping right in, what, in your opinion, is the state of the healthcare provider staffing as you see it today?
Yeah, I think when you kind of talk about the state of the staffing, first of all, I'll respond kind of with regard to clinical staff, not necessarily physicians, right? But I would really call it in a state of stress, right? There's practices that face a lot of different types of staffing challenges, and we've seen this progressing obviously since pre-COVID and all through COVID. But I actually see it in multiple ways inside the healthcare provider's practice. Like, I think some of the quotes that were sent out with the emails talked about short staff and the hospital system as being 20, 35% short staff. So, short staff is a big problem because that means patients are waiting longer to be treated. You have delays in scheduling. There's longer waits when they do get there, right? So that's just one area. There are providers that are having turnover, so maybe they've been able to maintain their staff, but they have a lot of turnover, right? So that means you're training more people, the staff that you have are less productive than your old staff, so that also creates a level of stress, right? I talked to a couple of different providers recently. A lot of our customers have told me in the specialty area, not in the hospital systems, but in the clinics, they've been able to maintain their staffing level, but it's way more expensive, like 25% more expensive to maintain the same staff. So regardless of whether you're short-staffed or you have your existing staff, but you're paying 25% more, right? Across the board, the one word that really keeps coming back week after week from the practices is burnout, right? This is a big problem. It started pre-pandemic, it's continued post-pandemic. And the staff that are in these clinics are just very stressed, right? And what happens is when the staff are stressed, right, the whole practice becomes stressed. And so it ultimately starts feeding down to the patients. And so that's kind of the way I would describe the current staffing from my perspective.
Yeah. I mean, I think you're absolutely right. We definitely see that the stress that is in the system is it sort of came into focus right around the pandemic, and it's continuing to stay its course, right? And folks are not willing to come back to work, or if they're willing to come back to work, there's obviously inflationary pressures and that burnout. So do you see staffing challenges resolving, or is it time for providers to adjust to this new normal?
You hear people talk about the Great Recession, and we're all talking about it. They actually just came out with a survey that Grant Thornton did. I was pretty shocked, but 21% of Americans took new jobs in the last year, right? That's a huge percentage of the workforce turning over. But the bigger story, and I think a lot of that was in the healthcare space, but the bigger story is that 40% of the people that took a new job are already actively looking for another job, right? So when we talk about time for providers to adjust, like, they're going to have to figure out how to adjust to a higher level of turnover, right? And the other thing that's contributing to that turnover is inflation and rising costs, right? I mean, it's a fact that changing jobs is actually one of the best ways to increase your salary, right? So, we're seeing these people move a lot more. And so one of the things about staffing that we kind of have to figure out is how do we deal with more turnover? And so we do see, I see a lot of flex staffing coming on, but they're dealing with these higher wages. So the practices that are kind of getting ahead of this are looking at implementing technology to try to increase that productivity and deal with some of that turnover.
Yeah. No, you're absolutely right. It sort of brings to mind the pandemic made us think through for employers and employees that maybe we were putting too much weightage around industry domain knowledge, right? People switched over from healthcare to retail to tech, and hospitality to something else, and they realized that they can make that switch, and for in many instances the switch is for the better. So I agree with you. I think the reality of high attrition, turnovers across all industries is going to be something we're going to have to learn to live with. And we're going to have to sort of make changes to our work environments to accommodate for some of that stuff. I was just at a large provider last week at one of our customers and talking to some of the staff, and they were losing folks to the local retailer who's now increased their minimum wages, and suddenly they look like a more attractive opportunity, even though there is so much specific healthcare skill set that these employees possess. They're like, hey, maybe it's easier to just switch over and have a better quality of life. They're not overworked in that environment. And so yeah, a lot of different dynamics at play there. So that kind of leads me into the next sort of thought there. What impact is staffing challenges having on the existing staff, you think?
Yeah, I think, we've already mentioned that burnout's probably the biggest issue. And for staff that have remained loyal and they've been committed, right, that they're at that point of burnout. And so the problem that you run into at that point is it really starts to impact not only the other staff, but it impacts the experience that staff provides for the particular patients, right? And so, it's not a direct analogy, but we've seen this through COVID, where stress really creates environments that are just not normal, right? And so, one example, and it's completely not in healthcare, but we've seen it in the airline industry with the whole unruly passenger thing. I mean, when airlines, kind of had to quit providing customer service and worry about safety and keeping passengers happy, and they became police, right? It just created an environment because of the stress where the passengers were, they had a horrible customer experience, and it creates more stress, and then it escalates, and it just, the end result is, you lose a lot of customers. And in the healthcare space, that patient experience is really critical. We operate today in what we call the experience economy, right? So patients are more driven as consumers. They're more quick to change. If they don't have a great experience, if they walk into a practice and they're still using paper and not using technology, that drives a lot of patients to change providers. And so it can impact the bottom line, which again, it just creates another stress on those staff. So, that burnout and the staffing challenges are really just growing and impacting the patient experience, which, it's kind of like a downward spiral, if you will, with the practices.
What are the ways technology can help increase the bandwidth of that existing staff and improve productivity? Sort of examples you may have come across or you've helped out with your providers.
Sure. I think, the key here is the administrative task, right? I mean, as a healthcare worker, you want to spend more time with the patient, right? Direct patient care. Everybody understands that that's what creates that great patient experience, and that's what improves outcomes, and that's what improves the practice, right? So what happens is we're just seeing more and more administrative tasks, right? Some of the statistics that just came out are that, the clinical staff spend as much as 40% of their time on administrative tasks and paperwork, right? And 60% patient facing, and physicians, it's even worse, right?
Yeah.
For every hour they're with a patient, they're probably spending 2 hours on documentation, right? So they're as much as 60% administrative. So that's the low hanging fruit, right? That's the area where we have to focus on how do we use technology to get rid of some of that administrative tasks so that the providers and the healthcare clinical workers can spend more time with the patient, truly administering that care. And that's what we look for in this technology. And so, and there's other things that are changing in the landscape as well, right? That are creating more administrative work, right? One of those areas is specialty drugs. If you look into the market about the new treatments and the new drugs that are coming out, there's a large number of those that are biologics. And with the growing number of these biologics, with the cost of those, there's a significant increase in requirements to do prior authorizations. And because of the cost, they're typically also associated with some type of a patient services program, and that requires an enrollment. And all of that is administrative work, and it's been there all along, but it's growing more and more as we see the landscape of healthcare change, right? So one thing, when we talk about implementing technology, there's a little bit of fear in practices sometimes, whether it's fear of change or just right now, because the staffing and the stress is so high, they don't want to take on anything new. So a lot of times they may look at technology as, hey, this is just too big, right? And some of that's hangover from, not too long ago when all these practices had to implement PM and new EMR systems, right? And that was a tough transition for a lot of practices. So they have a short memory and they're thinking, oh no, not new technology. This is going to be horrible, right? So it's really important to look for technologies that don't have that heavy lift. They don't have that friction, right? Technology that removes administrative tasks, right? But they're also very easy to learn and adopt. And that's really what the formula in terms of where technology can help improve the staffing size is. It's just got to focus on getting rid of administrative tasks, and it's got to be very easy to implement and to adopt.
Totally see that in from our worldview as well. I think the physician burnout around EMRs definitely comes into play when you're talking to them about adopting new technology. There's this instant sort of pushback because they live and breathe that even today, right? And
right.
So we try to educate them all along that times have changed and there is very light footprint SaaS solutions out there that are specifically targeted towards certain business processes that really do make an impact in terms of automation and relieving the stress that might exist on their staff and improving productivity. But it's a journey we have to take them on because fully sympathize with them on what they've gone through in some of the deployments on the EMR and what they have to do to keep their workload going, right? Every patient facing minute that they can, it goes away into spending in an EMR documenting notes. And so what do you think are your tips for areas where technology can make a sort of outsized impact for providers and patients?
One of the things I just keep hearing over and over is portal fatigue, right? It's like they're tired of going to 50 different payer portals with logins, trying to figure out how this portal works and this portal works, right? So if they can create these integrations that would take the data from their systems and put it into one place so they don't have to deal with all the different portals, right? Those are huge time savings. And I think, a lot of people think of technology as I'm going to go buy a new software and implement it, right? There's new software, like you mentioned, it's SaaS, there's no implementation, right? But to get the real value out of a lot of these SaaS solutions, you need to make the effort to do the integration and let those systems talk to each other, right? The two areas that we see the most is, and where we're implementing those technologies and practices, right, is enrollments into those patient services programs. So with a lot of the new biologics, the enrollment process can be complex and can long, and we could take 15, 20 minutes to manually fill out forms, and then you're dealing with faxes for all these patients, right? So that's an opportunity where you can remove all that handwritten enrollment And of course, the other big one, right, is prior authorizations, right? That's just, the administrative burden of sitting on the phone, going to 50 different payer portals and logging in and copying and pasting all that data out of your EMR system into their portals. Like that is just a huge administrative burden. I think it's a big part of that, 40% time that we could really improve. And so integrate and look for those opportunities to remove those administrative tasks. I'll actually, before you go on, I'll share a little story with you too. We have a customer who was implementing the electronic prior authorization solution, had really just completed implementing it. They had one dedicated full-time equivalent that did nothing but prior authorizations. They implemented an electronic prior authorization solution from us. And a few weeks later, that staff resigned, right? It's the same issue that everybody's having, the staff turnover hit. And what happened was they looked at the technology and they had really achieved such a reduction in effort to do their prior authorizations that they were literally able to continue to operate and not replace that resource. I mean, they did have to spread the workload out a little bit, right? But the reduction in labor was so significant when the turnover hit them, they were able to actually just share the labor a little bit with some other medical assistants. They do their own prior auths now because it takes so little time, right? And so that's just a great story how a practice really used technology, to gain a big benefit in dealing with their turnover situation.
Yeah, absolutely. We see that all the time as well. I think just to your point of integration and sort of challenging the IT teams, it resonates with me because I feel just making that initial push pays the dividends down the line and translates to a resiliency for the organization so that it can ride out these types of staffing challenges as well, where you lose trained resources. It gives you the luxury of time to be able to bring in new resources because you have a solution to fall back on. So time and again, we try to take our customers down the journey of integration. And again, talking them through it, that it's not as difficult as you may think. It requires a little bit of work, but that work for maybe 2 weeks, 3 weeks on the initial implementation does provide all the benefits downstream.
Right. And the great news is that you don't have to ask your healthcare staff to do that work, right? Yeah. Put that back on the IT staff. They'll take care of that and they can create a lot of value for you.
Yeah, absolutely. We'd like to wish everyone a great rest of the week and the weekend. And we look forward to seeing you next week here again. And Michael, thank you once again. It's been a pleasure sort of connecting with you, chatting on this subject, and I'm sure there's a lot more we can talk on this subject and many things healthcare.
Absolutely. Thank you all very much for having me today.